You feel that sudden, unmistakable pelvic discomfort. Maybe it's an intense itch, or you notice an abnormal discharge that wasn't there yesterday, and your immediate instinct is to find a fast answer. Most of us do the exact same thing. We open a browser, type in our symptoms, and look for a quick fix to just make it stop. But treating pelvic health like a simple matching game ignores a basic biological reality. Identical external symptoms, like burning or itching, can be triggered by entirely different organisms, ranging from an overgrown fungus to a microscopic parasite. When you try to self-diagnose an invisible ecosystem based on a few search results, you are taking a massive biological gamble. The exact odds of guessing the right target are incredibly low. To understand why a wrong guess matters, we have to look at the physical layout. The lower reproductive tract, the vagina, is just the entryway. Above it lies the upper reproductive tract, which houses the uterus and the fallopian tubes. This connection creates the pathway for what clinicians call an ascending infection, where untreated pathogens don't stay put, but instead move higher into the body. Looking at this cross-section, you can see how vulnerable these internal organs are. The uterus gateway is just centimeters from the lower tract. Applying the wrong cream temporarily soothes surface irritation, but underneath, the true pathogen is left unchecked, allowing it to travel upward. Guessing incorrectly at the pharmacy buys time for a dangerous pathogen to reach and damage your upper reproductive organs. Let's look at the two most commonly confused issues. The first is a yeast infection, which is a localized fungal overgrowth. This typically presents with highly specific external markers, an intense, persistent itch, and a curdy, thick white discharge. The second is bacterial vaginosis, or BV. Despite sharing some overlapping discomfort, BV is a bacterial imbalance, not a fungus. BV has its own defining markers, specifically a distinct grayish-white discharge, rather than a thick white one. Mapping this in a matrix of yeast versus BV, comparing pathogen type, discharge appearance, and physical sensation, the clinical differences are stark. However, because the general discomfort feels identical, patients often assume it's a yeast infection and buy the wrong medication. Applying antifungal treatment to a bacterial infection is biologically useless, guaranteeing prolonged symptoms and wasted resources. Then there is a third category of threat entirely, trichomoniasis, which is a parasitic infection. This parasite brings a completely unique visual presentation to the table, often appearing as a frothy greenish-yellow discharge, but pathogens don't always politely wait their turn. You can experience a mixed infection, where a parasite like trichomoniasis attacks simultaneously alongside a bacterial or fungal issue. When multiple organisms overlap like this in a mixed infection, they severely complicate your body's natural defense mechanisms. If you are dealing with a multi-organism attack, a single pathogen pharmacy cream will mathematically fail. You might kill off one bug, but the others will continue to thrive. Sexually transmitted infections, particularly chlamydia, present a different kind of challenge. The most dangerous characteristic of chlamydia is how it operates in the dark. In many cases, it presents with zero visible or physical symptoms. You wouldn't even know it's there. If left untreated, this invisible pathogen ascends, leading to a severe condition known as pelvic inflammatory disease, or PID. Inside the upper reproductive tract, PID causes aggressive cellular inflammation. Healthy tissue rapidly swells and shifts as the infection spreads. As the body tries to heal from this prolonged internal inflammation, it creates physical scar tissue. This scarring can permanently block the fallopian tubes, directly resulting in irreversible tubal infertility. Judging your internal reproductive health strictly by what you can see or feel externally is a catastrophic strategy that leaves your long-term fertility completely unprotected. Today, it's incredibly tempting to rely on telehealth apps or text-based medical consults to save time and avoid a clinic visit. But virtual visits have a strict biological limitation. A physician cannot culture a verbal description of a symptom over the phone. Trying to prescribe treatment through a screen involves an unavoidable degree of guesswork. To truly identify the pathogen, a physical examination of the tissue and fluid is absolutely necessary. Prioritizing the short-term convenience of a chat app over clinical accuracy results in a negative return on investment for your health. Resolving pelvic symptoms requires a specific protocol. The mandatory first step is booking an in-person gynecological or well-woman appointment. Once in the clinic, the doctor performs a physical swab to collect necessary samples, which are then sent out for a laboratory culture. This flowchart shows how lab cultures remove guesswork. It connects a clinical swab to definitive laboratory analysis, scientifically isolating the exact organism. With this identification, your doctor provides a targeted prescription to neutralize those exact pathogens. You must complete the entire course. Things like wearing cotton clothing, staying hydrated, and avoiding douching are excellent preventative habits, but they are only effective after the active infection has been clinically eradicated. Trading the afternoon hassle of an in-person clinic visit for an accurate diagnosis is the only scientifically sound method to protect your reproductive lifespan and put an end to the cycle of chronic pain.